Welcome to a review of Protocol 9-6, Southeast Michigan EMS Medication Exchange and Replacement Procedure. I'm Doug Miles, EMS Coordinator at Star EMS, a private ambulance service based in Oakland County, Michigan. Many paramedics learn how to exchange a Southeastern Michigan EMS medication box by having their partner walk them through the process a few times. See one, do one, teach one. This type of on-the-job training does not replace the need to actually read the medication exchange protocol and appreciate the responsibility that goes to the one who signs the replacement form. My goal today is to cover some of the technical and procedural aspects of the protocol, as well as to give some insight into the trouble that can occur when we don't fully appreciate our duty. As you have heard before, protocols are not guidelines. They carry the weight of law. Following them is not optional. Here on out, I'm going to refer to the Southeastern Michigan EMS medication box as the drug box, the colloquial term that Oakland County paramedics use for it. These rules apply to the drug box, as well as the yellow accessory pack, or APAC, and the soon-to-be-released BLS medication kits. Throughout this video, you should understand that when I say drug box, it also goes for any hospital-provided medication package we carry on the ambulance. Let's begin. Each drug box is identified with a box number, sealed with a green breakaway tag stamped with the serial number, and affixed with a yellow sticker prepared by the hospital pharmacy where it was last exchanged. The yellow sticker should be examined at the beginning of your shift to note the box number, green tag number, and the expiration date. Per Protocol 9-6, drug boxes are to be exchanged if they are within 7 days of this expiration date. This is the paramedic's responsibility. When we complete an ALS or BLS ambulance check each day, this information must be noted for our records. When the pharmacy restocks a drug box, they will replace the yellow sticker. There is no need to open a drug box to verify the contents inside. The presence of the intact green breakaway tag ensures that the box is stocked and ready for use. Protocol 9-6.1 has a schematic for the location of each medication inside the drug box. This protocol includes all the forms associated with drug box exchange. I will discuss these later. Should there be a medication shortage or a supply chain disruption, pharmacies may opt to stock the drug box with an alternative medication package. There will always be a warning sticker placed prominently on the top of the drug box to alert the medic of the variance. In some cases, we have had to mix 1-to-1 epinephrine into 1-to-10 epinephrine using a 10 ml saline flush provided by the pharmacy, or draw up dextrose from 10-gram vials instead of a 25-gram pre-filled syringe. The hospitals try their best to avoid these situations, but market forces and Mother Nature don't always play nice. When you examine the drug box during your ambulance check, you should note that the green tag is intact. The green tag is evidence that the box has not been tampered with. A broken or missing green tag indicates that the box is open and your ambulance is out of service until it is replaced. Sometimes green tags are broken accidentally, usually by carrying the box so as to brush against the paramedic's leg. It has happened that crews have neglected to exchange a box after opening it, and that box gets discovered by a different crew performing their daily check. Whoever discovers the open box now owns it. It is your responsibility to report the incident to supervision, as well as to the replacing pharmacy. This is known as a discrepancy, a catch-all term that encompasses any situation where things are not as they should be. It is wise to immediately call upon a witness to the discrepancy, lest suspicion fall upon the one who discovered it. A thorough inventory should be performed to determine what, if anything, is missing. A supervisor or pharmacist should be contacted if you are unsure of the correct procedure to follow. Anything missing should be noted on the discrepancy form, which is turned into the pharmacy and in turn sent to the OCMCA for investigation. If you do this job long enough, these types of situations can happen. Sometimes they are caused by poor communication, inattention, or just good old-fashioned laziness. Sometimes they are due to a type of medication theft called drug diversion. This means the medication is taken by someone other than the intended patient or used for purposes not prescribed by a medical professional. Diversions are very difficult to investigate. This is a premeditated act by someone who has become desperate enough to betray the principles they once dedicated themselves to. The drug box might be passed from person to person before the discrepancy is detected. You do not want to become implicated in a drug diversion investigation. If your partner is doing anything with the drug box that makes you uncomfortable, you should speak with them directly and not look the other way. The trust you build with your partner makes it difficult to confront them. They are probably counting on that to help them get away with it. Ask questions. If you're not satisfied, bring in a supervisor. All the freestanding hospitals in Oakland County, as well as in Lapeer, Livingston, Macomb, Monroe, St. Clair, Washtenaw, and Wayne County, participate in this drug box exchange program. The medications supplied in the drug box are provided by the hospital system and may include some not approved for use in Oakland County. For example, the antibiotic ceftriaxone is used to treat open fractures in the pre-hospital setting. It is not approved for use in Oakland County, which did not adopt the protocol as Macomb County did. This is clearly specified in the soft tissue and orthopedic injuries protocol. It is your responsibility to read, understand, and follow the protocols approved by our Oakland County Medical Control Authority Medical Director. This would be Dr. Steve McGraw, an emergency physician who works out of Henry Ford Southfield, formerly known as Providence Hospital. When you administer a medication to a patient in Oakland County, in accordance with our written protocols, you are operating under Dr. McGraw's medical license. Should you receive direct medical control instructions from a hospital-based emergency department physician, you would be operating under that physician's medical license. Thus, it is possible you could give ceftriaxone to a patient with an open fracture if you contacted medical control, specifically requested it, and received a physician order. All medications must be kept in a room temperature environment. This can be a challenge in Michigan. We have boiling hot summers and polar vortex winters. Medications may become chemically unstable if exposed to high or low temperatures. This requires them to be destroyed and replaced, which is very expensive, even by hospital standards. Hospitals ask us not to run the ambulance engine when we are parked under the ER canopy. We sometimes have to give up our personal conveniences in order to protect our medications. Parking away from the canopy may be necessary so we can run the climate control system. If an ambulance is going to be parked outside and not in service, pharmaceuticals like the drug box, APAC, IV fluids, and saline flushes should be removed and secured inside the station. If a drug box is allowed to freeze or cook, you can bet it is going to require a discrepancy form, and you will be receiving a letter from PSRO. Ensuring the drug box is clean and all trash removed is the responsibility of the paramedic who exchanges the drug box. The box must not have any contamination inside or outside. If you use something from the box, the pharmacy does not want it returned. Even if you weren't the one to leave the trash in the box, it is your problem now. We once had a discrepancy reported because the pharmacy discovered an uncapped needle at the bottom of an APAC that my agency had exchanged. All the crew had used was oral ondansetron. No needles were utilized. It didn't matter. We were the last party in the chain of custody. Empty medication vials or used syringes do not go back in the box. Dispose of them properly and document their use on the replacement form. Let's say that you are preparing to use a vial of midazolam to stop a seizure. After you broke the green tag and opened the drug box, you grabbed an alcohol prep, a 3 milliliter syringe, and a 5 milligram vial of midazolam. You pop the tamper-proof seal off the vial, and then your patient abruptly stops convulsing. The midazolam is no longer needed, and the rubber seal is still intact. Can you just return it to the box so it can be used later? No. You removed the seal. No one at the hospital is going to be certain that the medication wasn't tampered with now. It must be wasted, and your PCR should note the midazolam was opened but not given. This happens nearly every day. If your actions are explained, there will be no suspicion. If you were lazy and pretend like nothing happened, the pharmacist is going to discover it, fill out a discrepancy form, and send it to the OCMCA. The OCMCA is going to contact me, and I'm going to track it back to you, make you fill out an incident report, a replacement form, and amend your PCR. You've wasted a lot of people's time all because you didn't want to exchange a drug box correctly. Drug boxes must be stored in a secure area in the ambulance when not in use. This is protocol and just common sense. EMS drug boxes are not common targets for thieves and junkies, but let's not tempt fate. Each ambulance has a secure area where the box should reside until it's time to use it. When not in service, the ambulance should be locked up and the keys turned in. If anyone walking by can open the door and remove your drug box, that's a big problem. If the green tag is removed, a replacement form must be completed. A blank form is located on the bottom shelf of the drug box for your convenience. A PDF of the form is available in Protocol 9-6.1. The completed form is then placed inside the box, and then the box is sealed with a red tag found on the top shelf of the drug box. The top of the replacement form is completed thus, taking care to write legibly. The hospital may bill the patient's insurance for reimbursement of the medication we administer, depending on their internal policy. Be careful to account for everything that was removed from the box because the hospital has to replace it. Give particular attention to the controlled substances, commonly referred to as narcotics or narcs. The dose given and the dose wasted must balance with the amount in the vial. Any waste must be witnessed by your partner. The form instructs us to print our names, but the pharmacy only cares that the space has a name in it. If you sign it or print it, they really don't mind. Take care that the medications and doses you documented you gave in your PCR and the medications you documented you used on the drug box replacement form all match. Enter the replacing hospital. If a controlled substance was given in accordance with protocol, Dr. Steve McGraw should be in the MCA Medical Director's name spot. If a controlled substance was given due to online medical control physician orders, you must document his or her name. If no controlled substances were given, this line stays blank. Paramedics statement. Once you have acquired a replacement drug box sealed with a green tag, you can fill out this section. Enter your open drug box number. Enter your replacement drug box number, the green tag serial number. The paramedic signs and dates the statement. The completed form goes into the drug box. Before the box is sealed with the red tag, the controlled substances should be examined, even if none were used on the response. Count the narcs. 1, 2, 3, 4. 1 vial of ketamine, 2 vials of morphine, 3 vials of fentanyl, and 4 vials of midazolam. If you forget and don't turn in all the albuterol vials you removed from the box, the pharmacy will usually not report the discrepancy, but narcs are a red line. Be careful around the narcs. The red tag seals the box closed. The pharmacy logbook is filled out. The red tagged box is left in the secured area, and you are back in service. The pharmacy logbook can be found in the vicinity of the drug box exchange area. This is a backup record in case the replacement form goes missing. It is your responsibility to fill this out each time you exchange a drug box. If you are unable to locate it, be responsible and inform the pharmacy that it is missing. What should you do if the drug box is approaching or past its expiration date? Just do a box exchange, making a note on the replacement form that nothing was used and the box was past expiration. Easy peasy. What should you do if you seal the drug box with the red tag and then realize that you have forgotten to replace everything that you removed? Something minor, like the bag of ancillary supplies, can be left on top of the box in the drug box exchange area. The pharmacy techs who replaced the boxes will know what happened. If medications were left out of the box, it's best to walk everything up to the pharmacy and ask for guidance. They are not going to overreact or get sarcastic. Hospital pharmacists are actually pleasant, well-adjusted professionals. You're probably thinking about retail pharmacists. The bottom line is, if you're not sure what you should do, just ask. Don't guess. Don't assume. Ask a subject matter expert. There's one in every pharmacy.